afya yangu, bima yangu, shamba. Today I've been invited in Afya Fest Summit, and I've learned a lot based on our health. Today I'd like to brief Kenyans that SHA is very operational. It's just some of the cartels are trying to sabotage the system. My advice to my fellow Kenyans is that you must have your insurance for you to get your treatment. So for me, my advice as the ambassador of SHA Insurance, and I'm an ambassador based on experience, and I'm looking forward to work with the progress government if given an opportunity. And my prayer is to remind the President William Ruto V to give me an opportunity to engage more youths in SHA awareness in the country. And this is the opportunity that I'm looking for. I've written a proposal and a budget based on SHA Insurance. If given an opportunity, I will create employment in that department. So I'm reminding the CS, who is Mr. Ndwale, to give me that opportunity, and still reminding our PS, Modoni, and still reminding our CEO in SHA Insurance, giving me an opportunity to create awareness in the community. I'll be very happy as an ambassador. We will do an inclusive project whereby we are going to bring the Gen Zs together. We do a timeline of educating them based on how SHA operates. Then we are going to engage with the larger community, the 47 counties. If it is possible, if I get resources from the broad-based government, I will inject the whole country, because I'm more advanced based on how SHA operates. Because I was a victim, got discharged with SHA in Kenyatta National Hospital. If given an opportunity with the broad-based government, my job as an ambassador, it will be to educate the 47 counties that are left behind based on how SHA operates. So my prayer is to meet with the President or to meet with the CS based on how SHA operates, because most of the citizens, most of the foreigners in the country, they are so much behind on how SHA operates. So my prayer is to the broad-based government to engage me as an ambassador, and I promise I'm going to deliver for Kenyans. I'm going to fix where the loophole is. We have got a big loophole in that insurance. Based on the fraud that happened just the other day, still the government is doing an investigation based on that. And very soon we are going to give answers, because we are there to serve humanity. So me as an ambassador, I'm still pushing the agenda based on how SHA operates. And for me, I'm limited because of lack of resources. If given an opportunity, I will fix that insurance based on what should happen. And my idea and my take is based on how to fix that insurance. And I've done my research. That insurance, where the loophole is on the premium. Like now today, the rich are paying a different premium with the poor. So we need to make the premium standard. And my prayer is the government to give me an opportunity based on that insurance, and I'm going to give answers on how we are going to fix that loophole. So my prayer is to the broad-based government to give me an opportunity to fix the country, because the country is complaining about that insurance. And for me as the ambassador, it's not that I'm happy, and I'm trying to engage the community based on that insurance. I've done it at Mutwini Level 4 Hospital in Dagoretti South, whereby I've done an inclusive awareness to the whole community of Dagoretti South and North. So my prayer, and I keep repeating this, is to get an opportunity to work with the broad-based government based on that insurance, and I'm going to deliver as a leader. As a leader, I'll be the voice of the people. I'll be there and become a good listener as an ambassador. There now we fix where the loophole is, because most of the Kenyans are still complaining about it, are still having doubts on that insurance. But I can assure Kenyans, if it will be an inclusive discussion based on how to fix that loophole, I'll be there as an ambassador to guide. And if I am given an opportunity with the broad-based government, I'm going to fix it based on what should be fixed. Because at the end of the day, you as a leader, you should be a good listener, and you fight impunity in the society based on the cartels who are trying to bring that insurance down. So for me, my advice is to work with all Kenyans. My advice is to put health as a priority, because for me, all Kenyans are supposed to get treatment if they pay the insurance in time. And I will assure all Kenyans, if I'm given an opportunity as an ambassador, I'll make Kenyans proud. That is the opportunity that I'm looking for. And my prayer is to the broad-based government. If I get the opportunity, I'll push it to another level.
Yes, Mr. Douglas.
Yes.
I have a question here. What mechanisms will you have to, or will you advise the government to put in place to ensure that SHA independency from the Ministry of Health and Digital Health Authority, especially regarding to control of its IT system?
All right. Now, if I might be precise, based on answering that question, based on the fraud that happened the other day, the government is into research based on the victims, so that now the victim will be taken to law. Then the other thing that the government is planning is to bring the in-house to do more investigation based on that insurance. And very soon, the government will give answers based on that insurance.
And another question, Mr. Chief. Given the parallels between NHIF and SHA scandals, how is the government ensuring that SHA is not just like NHIF rebranded, but truly transformative to this country?
Number one, I will say that SHA is better than NHIF based on the services that we are getting into SHA. SHA is giving support to three parties. Party number one, citizens. Party number two, refugees. Party number three, residents. So I will assure you that SHA is better than NHIF based on the services that we are getting from SHA. And the limit of SHA insurance is from 0 to 800K, especially to the admitted patients. And to the outpatients, to all level 4 hospitals, they are giving support based on those members who have registered into SHA insurance.
All right, that's a very good answer. And do you think can SHA commit to publishing monthly reports on facility claims and suspension to rebuild public trust?
Number one, the government is planning to come up with a mechanism of tracking the finances into SHA insurance. And very soon, I assure Kenyans, the government will come up with a solution based on monthly payment. And our push to the broad-based government is to make the premium standard. After making the premium standard, they should be writing a report on a monthly basis whereby Kenyans will be allowed to be paying their SHA insurance on a monthly basis, because the yearly basis, it is giving Kenyans a challenge. Even the monthly is not that much supporting Kenyans. We need to come up with a fixed premium and affordable premium, because I believe health is a priority in our country.
Right, maybe the last question from my end. What steps will you advise the government, or the government is taking, to ensure that SHA has full ownership and control of its infrastructure, software and data, especially given the Auditors General's warning about private ownership of public systems?
Now the government is coming up with a system that will be tracking all the finances that are into SHA insurance, and very soon the government will be discussing, the government will be discussing on the answers based on what the questions that Kenyans are asking about their money that was there in NHIF got transferred to SHA insurance. But I will assure Kenyans that the money that was in NHIF, it was used to transform the system into SHA and to make it affordable to every citizen or every person who is living in Kenya should be getting services based on that insurance. Only if you register as a member, you will get your services on time.
Right, and maybe we can, you can shed some more light about this. How were billions paid to clinics with no beds, no staff, and no physical presence? What verification protocols failed, and who is being held accountable for that?
Number one, the government is still doing the investigation, and I will assure Kenyans very soon we are going to get answers based on that fraud that happened just the other day. Number two, some of the Kenyans are trying to sabotage the system, and I assure you the government is very transparent based on giving services to that insurance. Some of the cartels are trying to put a lot of impunity into that insurance, and the government is ready to do thorough investigation, and very soon we will be getting answers based on that insurance and where the money went.
And what role can youth-led organizations and civil society play in monitoring SHA's reforms and ensuring grassroots accountability?
What they can do is to make it an inclusive insurance, whereby we include Mama Boga, Mutu ya Boda Boda. They need to know how insurance operates, because at the end of the day, what the Kenyans are missing is the awareness based on that insurance. That is what the citizens are missing. And we, as the ambassador, have written a proposal and written a budget based on 3,000 Gen-Zs who will get employment if I get support from the broad-based government. I'm just looking for resources so that I can engage most of the Gen-Zs at work so that they are able to educate the large community. They are able to move around the 47 counties and educate Kenyans based on that insurance.
All right. Another question, Douglas, kindly. Do you think if given the chance to work with the government, will the government commit to regular public forums where citizens can question SHA leadership and review monthly performance reports?
In the government of William Samoei Ruto V, I will assure you it is a very transparent system whereby he's planning to do an inclusive summit to all citizens based on that insurance. He's ready to bring all the 47 counties together based on how SHA operates, because that is where the system failed. When the transfer of SHA, of NHIF to SHA, what missed, or it was public awareness. And the government is planning to do the public awareness. My prayer is that they bring me through as an ambassador, because I'm well informed based on that insurance. They give me an opportunity to do an inclusive movement that we call it SHA awareness ndani mashinani. So we will be able to educate the larger community based on how SHA operates.
All right. Okay, thank you so much, Mr. Chief Douglas. And there's a question being raised by my friend here.
Yes.
What legal reforms can be considered to prevent future misuse of public funds in health sector digitization and infrastructure? Maybe if I can repeat again. What legal reforms are being considered to prevent future misuse of public funds in health sector digitization and infrastructure?
So the plan of the government, after doing the public awareness, after informing all communities about SHA insurance, they'll be able to come up with a mechanism on reaching to every citizen, every foreigner, every resident who is living in Kenya, based on how they pay their insurance. The government is planning to come up with a scheme of doing follow-up. Yes.
All right, thank you so much, Mr. Douglas. We wish you well, and we are looking forward. Maybe the government can consider these and at least wakuite mahali maza. Thank you so much, sir.
Thank you.
All right.